Question 1. A central service technician observes a coworker consistently failing to follow proper hand hygiene protocols before handling sterile instruments. According to professional ethical guidelines, what is the most appropriate initial action? A. Report the coworker directly to the state health department. B. Confront the coworker aggressively and demand they comply. C. Document the incidents and discuss the concern with a supervisor. D. Ignore the behavior, as it is the coworker's personal responsibility. Answer: C. Document the incidents and discuss the concern with a supervisor. This question tests your understanding of professional ethics and reporting protocols within a healthcare setting. The keyword "most appropriate initial action" indicates that you should choose the first, most constructive step. Ignoring the behavior, D, is irresponsible, while immediately contacting an external agency, A, or confronting aggressively, B, are extreme and unprofessional first steps. The correct approach is to document observations and report them to your supervisor, who is responsible for addressing staff performance and ensuring patient safety protocols are followed. For example, if you see someone not washing their hands, jot down the date and time, then quietly bring it to your supervisor's attention so they can intervene properly. Remember, always follow your facility's chain of command for reporting concerns. Question 2. Which of the following is the primary reason for proper body mechanics when lifting heavy instrument trays in central service? A. To increase the speed of task completion. B. To prevent musculoskeletal injuries to the technician. C. To ensure instruments remain sterile during transport. D. To improve teamwork among staff members. Answer: B. To prevent musculoskeletal injuries to the technician. This question focuses on the essential concept of ergonomics and personal safety in the workplace. The keyword "primary reason" directs you to the most critical outcome of using proper body mechanics. While other options might indirectly relate to workplace efficiency or sterile practices, the core purpose of body mechanics, such as bending knees and lifting with legs, is always to protect the individual from strain, sprains, and other musculoskeletal injuries. For instance, lifting a heavy tray incorrectly from your back can cause severe pain and missed work. Always remember that protecting your own body is crucial for your long-term career in central service. Question 3. What is the main purpose of the Occupational Safety and Health Administration, OSHA, within the Central Service Department? A. To accredit healthcare organizations for quality and safety. B. To regulate the manufacturing and distribution of medical devices. C. To ensure a safe and healthy working environment for employees. D. To develop recommended practices for sterile processing. Answer: C. To ensure a safe and healthy working environment for employees. This question assesses your knowledge of key regulatory agencies relevant to central service. The keyword "main purpose" directs you to OSHA's core mission. While other agencies are responsible for accreditation, TJC, medical device regulation, FDA, or recommended practices, AAMI, OSHA's specific role is to protect workers from hazards, ensuring their safety and health on the job. For example, OSHA sets standards for blood-borne pathogen exposure and chemical safety in the workplace. Always associate OSHA with worker safety and workplace standards. Question 4. A new central service technician is having difficulty understanding complex medical terminology used by the surgical team. What communication barrier is most evident in this scenario? A. Environmental noise. B. Semantic barrier. C. Emotional barrier. D. Physical barrier. Answer: B. Semantic barrier. This question delves into understanding different types of communication barriers. The situation describes difficulty with complex medical terminology, which is a clear indicator of a semantic barrier. A semantic barrier occurs when there is a misunderstanding due to different interpretations of words, jargon, or language. For example, a surgeon might use a term like hemostat assuming everyone knows it's a clamping tool, but a new technician might not. Remember that a semantic barrier is essentially a language barrier, where words mean different things to different people or are simply unfamiliar. Question 5. Which of the following best describes an internal customer in the context of the central service department? A. A patient receiving care in the hospital. B. A vendor supplying sterile processing equipment. C. A surgeon requesting sterilized instruments for a procedure. D. A family member inquiring about a patient's status. Answer: C. A surgeon requesting sterilized instruments for a procedure. This question tests your understanding of customer service concepts, specifically differentiating between internal and external customers. The keyword internal customer refers to individuals or departments within the same organization who rely on the services or products provided by another department to do their jobs. Patients, A, vendors, B, and family members, D, are typically considered external customers. Surgeons, nurses, and other hospital staff who receive instruments from central service are prime examples of internal customers. Think of it this way: anyone within your own hospital who needs something from CS is an internal customer. Question 6. When a central service technician discovers a breach of patient confidentiality, such as protected health information, PHI, being improperly accessed, what is the immediate ethical responsibility? A. To confront the individual who accessed the information. B. To ignore it if no harm was done to the patient. C. To report it immediately to a supervisor or designated privacy officer. D. To post a warning about confidentiality on a public bulletin board. Answer: C. To report it immediately to a supervisor or designated privacy officer. This question addresses the critical ethical and legal responsibility related to patient confidentiality and HIPAA. The keyword immediate ethical responsibility highlights the urgent and correct action. Ignoring the breach, B, is illegal and unethical. Confronting the individual, A, can escalate the situation unprofessionally, and public posting, D, is not the correct procedure for handling a breach. The only appropriate and required action is to promptly report any suspected or confirmed breach of protected health information, PHI, to the proper authority, like a supervisor or the facility's privacy officer, to ensure it's handled according to policy and law. Always remember that patient confidentiality is paramount, and any breach requires immediate internal reporting. Question 7. According to fire safety protocols, what should be the first action taken by a central service technician upon discovering a small fire in the department? A. Attempt to extinguish the fire with the nearest extinguisher. B. Close all doors to contain the fire. C. Activate the fire alarm and evacuate personnel. D. Call 911 immediately. Answer: C. Activate the fire alarm and evacuate personnel. This question tests your knowledge of critical fire safety procedures, specifically the RACE acronym. The keyword first action is crucial here. While using an extinguisher, A, might be an option if the fire is very small and you are trained, the universally recognized first step in any fire emergency is to rescue individuals, activate the alarm, contain the fire, and evacuate. Therefore, activating the alarm and ensuring personnel safety, C, takes precedence over attempting to fight the fire or calling 911 directly, as the alarm automatically alerts internal hospital fire teams and often dispatches emergency services. Always remember RACE: rescue, activate, contain, evacuate, and activation is key. Question 8. A central service technician must document the processing parameters for each sterilization load. What is the primary purpose of this detailed documentation? A. To justify the department's budget requests. B. To prove compliance with accreditation standards and allow for traceability. C. To determine individual employee performance metrics. D. To assist in ordering new sterilization equipment. Answer: B. To prove compliance with accreditation standards and allow for traceability. This question emphasizes the critical role of documentation in central service. The keyword primary purpose points to the most significant reason for meticulous record keeping. While documentation might indirectly relate to budgeting, A, equipment ordering, D, or performance, C, its fundamental purpose is to provide an audit trail, demonstrating that instruments were processed correctly, meeting regulatory and accreditation requirements, and allowing for traceability in case of a recall or infection. For example, if an infection occurs, detailed records can show exactly which sterilization cycle a particular instrument went through. Always remember that comprehensive documentation is crucial for patient safety, legal compliance, and quality assurance. Question 9. Why is active listening particularly important for central service technicians when communicating with healthcare professionals from other departments? A. To quickly end conversations and return to tasks. B. To gather critical information and prevent misunderstandings about instrument needs. C. To appear busy and focused during interactions. D. To challenge the speaker's requests or instructions. Answer: B. To gather critical information and prevent misunderstandings about instrument needs. This question explores the importance of effective communication, specifically active listening. The keyword particularly important highlights the significant impact of this skill. Active listening, which involves fully focusing on, understanding, responding to, and remembering what is being said, is vital because it ensures that crucial details about instrument requirements or patient care are accurately conveyed and received. Misunderstandings due to poor listening can lead to incorrect instrument sets being prepared or delays in the operating room. For example, if a nurse calls asking for a lap set, actively listening and clarifying what specific instruments are needed prevents errors. Always remember that active listening helps ensure patient safety and efficiency by preventing miscommunication. Question 10. The concept of continuous quality improvement, CQI, in central service primarily aims to: A. Identify and punish staff members for errors. B. Maintain the current level of service without changes. C. Systematically identify and solve problems to improve processes. D. Reduce the department's operational budget by cutting corners. Answer: C. Systematically identify and solve problems to improve processes. This question tests your understanding of continuous quality improvement, a core principle in healthcare. The keyword primarily aims to refers to the main objective of CQI. CQI is not about blaming individuals, A, or maintaining the status quo, B, nor is it about cutting corners, D. Instead, it's a proactive, ongoing effort to analyze processes, find areas for improvement, and implement changes to enhance efficiency, safety, and patient outcomes. For instance, if there's a recurring issue with instrument missing from a set, CQI involves analyzing why it happens and implementing a new checklist. Remember, CQI is about constant growth and making things better, not just fixing mistakes. Question 11. What is the primary role of the Association for the Advancement of Medical Instrumentation, AAMI, in central service? A. To enforce federal laws regarding workplace safety. B. To develop recommended practices and technical information for medical devices. C. To accredit healthcare organizations and facilities. D. To investigate and control infectious diseases. Answer: B. To develop recommended practices and technical information for medical devices. This question differentiates between the roles of various regulatory and professional organizations. The keyword primary role focuses on AAMI's specific contribution. While other organizations handle workplace safety, OSHA, accreditation, TJC, or infectious disease control, CDC, AAMI is unique for its focus on creating voluntary standards and recommended practices for the use, care, and processing of medical devices. For example, AAMI publishes detailed guidelines on steam sterilization and instrument cleaning. Always connect AAMI with best practices and technical guidance for sterile processing. Question 12. A central service technician is asked to retrieve a specific instrument from a sterile storage area. Upon locating it, the technician notices a tear in the sterile wrapper. What is the immediate ethical action the technician must take? A. Use adhesive tape to cover the tear and proceed as usual. B. Set the instrument aside and report the integrity breach. C. Leave the instrument and assume someone else will find it. D. Discard the instrument directly into the regular trash. Answer: B. Set the instrument aside and report the integrity breach. This question assesses your ethical responsibility and understanding of sterile integrity. The keyword immediate ethical action emphasizes the urgency and correctness of your response. A torn sterile wrapper means the instrument is no longer sterile and cannot be used for patient care, making options A and D dangerous and improper. Leaving it, C, risks it being used accidentally. The correct action is to immediately remove it from the sterile supply and report the integrity breach to a supervisor so it can be reprocessed properly, ensuring patient safety. Always remember, if a sterile barrier is compromised, the item is considered contaminated. Question 13. Which action demonstrates professional behavior by a central service technician when handling a complaint from an operating room nurse? A. Immediately becoming defensive and arguing with the nurse. B. Interrupting the nurse to explain why the problem occurred. C. Listening attentively, apologizing for the inconvenience, and offering to resolve the issue. D. Referring the nurse to a different department to handle the complaint. Answer: C. Listening attentively, apologizing for the inconvenience, and offering to resolve the issue. This question evaluates your understanding of professional conduct and effective customer service. The phrase demonstrates professional behavior is the key. Becoming defensive, A, interrupting, B, or deflecting responsibility, D, are all unprofessional and unhelpful responses. The most professional approach when receiving a complaint is to practice active listening, acknowledge the concern by apologizing for the inconvenience, and then take steps to resolve the problem or find someone who can. For example, if a nurse complains about a missing instrument, a professional technician listens, apologizes, and then immediately works to find the instrument or a replacement. Remember, empathy and problem-solving are hallmarks of professionalism. Question 14. What is the primary purpose of the Joint Commission, TJC, for healthcare organizations, including those with central service departments? A. To develop and enforce federal laws related to medical device reprocessing. B. To provide accreditation by evaluating an organization's compliance with quality and safety standards. C. To regulate pharmaceutical drug manufacturing and distribution. D. To issue guidelines for infectious disease prevention and control. Answer: B. To provide accreditation by evaluating an organization's compliance with quality and safety standards. This question distinguishes between the roles of various healthcare organizations. The keyword primary purpose focuses on TJC's core function. While other bodies deal with federal laws, e.g., FDA, OSHA, drug manufacturing, or disease guidelines, CDC, the Joint Commission's main role is to accredit, certify quality, healthcare organizations. They do this by evaluating whether hospitals and their departments, like central service, meet specific standards for patient safety and quality of care. For example, TJC surveys ensure that hospitals follow proper instrument reprocessing procedures to prevent infections. Always link the Joint Commission with accreditation and patient safety standards. Question 15. A central service technician is assigned to clean surgical instruments. Which of the following best describes the term bioburden in this context? A. The weight of the instrument tray. B. The amount of visible dirt and debris on the instrument. C. The number of microorganisms on a contaminated item. D. The type of cleaning solution used for decontamination. Answer: C. The number of microorganisms on a contaminated item. This question tests your understanding of fundamental infection prevention terminology. The term bioburden is a specific and crucial concept in sterile processing. While visible dirt might be present, bioburden specifically refers to the amount of viable, living, microorganisms, such as bacteria, viruses, or fungi, present on an item before it is cleaned or sterilized. This is important because a higher bioburden requires more rigorous cleaning and sterilization to ensure safety. For instance, an instrument used in a highly contaminated surgical site will have a high bioburden. Always remember that bioburden refers to the microscopic living contaminants. Question 16. What is the main reason central service technicians must be aware of and follow the hospital's chain of command? A. To limit communication with other departments. B. To ensure proper reporting of issues and efficient decision-making. C. To avoid personal responsibility for errors. D. To only communicate with the highest-ranking executive. Answer: B. To ensure proper reporting of issues and efficient decision-making. This question assesses your understanding of organizational structure and its importance in a healthcare setting. The main reason for following the chain of command is about maintaining order and efficiency. It ensures that information, concerns, and decisions flow through the appropriate channels, preventing confusion and ensuring problems are addressed by the correct authority level. For example, if you have a safety concern, you report it to your direct supervisor, not immediately to the hospital CEO. Adhering to the chain of command promotes effective communication and problem resolution within the department and the hospital. Question 17. When lifting a heavy case cart, a central service technician should primarily use which set of muscles? A. Back muscles. B. Abdominal muscles. C. Leg muscles. D. Arm and shoulder muscles. Answer: C. Leg muscles. This question directly relates to safe lifting techniques and ergonomics in the workplace. The keyword primarily use indicates the main muscles that should be engaged during a proper lift. Lifting with your back can cause severe injury, and relying solely on arms or shoulders is inefficient and dangerous for heavy loads. Proper body mechanics dictate that you bend at your knees, keep your back straight, and push up using the strong muscles in your legs. For example, imagine doing a squat when lifting something heavy off the floor. Always remember to lift with your legs, not your back, to prevent injury. Question 18. Why is proper labeling and storage of chemical detergents and disinfectants crucial in the central service department? A. To ensure they are aesthetically pleasing. B. To prevent chemical spills and accidental misuse. C. To track the department's chemical budget. D. To allow for easy identification by external auditors only. Answer: B. To prevent chemical spills and accidental misuse. This question highlights the importance of chemical safety and hazard communication. The phrase crucial and the mention of chemical detergents and disinfectants point to the dangers associated with these substances. While other options might have some minor relevance, the primary reason for proper labeling and storage is to prevent accidents, such as spills, incorrect mixing, or exposure to hazardous substances, which could harm staff or damage instruments. For example, mixing bleach with an acid-based cleaner can create toxic fumes, so clear labels prevent such errors. Always remember that chemical safety is paramount for staff well-being and operational integrity. Question 19. A central service technician receives a verbal order for priority processing of an instrument set. What is the most important communication technique to employ to ensure accuracy? A. Nodding and writing down the order later. B. Telling the sender that verbal orders are not accepted. C. Repeating the order back to the sender for confirmation. D. Asking another technician to confirm the order instead. Answer: C. Repeating the order back to the sender for confirmation. This question focuses on a vital communication technique for ensuring accuracy in critical situations. The keyword most important communication technique points to a method that directly verifies understanding. Simply nodding, A, or relying on another technician, D, does not confirm your personal understanding, and refusing the order, B, might not always be feasible or appropriate. Repeating the order back, also known as read back, allows the sender to correct any misunderstandings immediately, preventing errors and ensuring the correct instrument set is prioritized. For example, if someone says priority for ortho tray, you repeat you need the orthopedic tray prioritized, correct? This confirms accuracy. Always remember, when in doubt, repeat it out, to ensure accuracy. Question 20. When dealing with an upset surgeon who is complaining about instrument availability, a central service technician should first: A. Explain all the reasons why the instrument is not available. B. Tell the surgeon to speak to the supervisor. C. Listen actively and acknowledge the surgeon's frustration. D. Walk away from the conversation to avoid conflict. Answer: C. Listen actively and acknowledge the surgeon's frustration. This question tests your ability to handle difficult customer service situations professionally. The keyword first indicates the initial step in de-escalating the situation. Immediately explaining reasons, A, can sound defensive, telling them to speak to a supervisor, B, passes the buck, and walking away, D, is unprofessional. The best initial response is to listen without interrupting and acknowledge their feelings, showing empathy. This helps diffuse anger and opens the door for a constructive conversation about finding a solution. For example, you might say, I understand your frustration, let me see what I can do to help. Always remember that empathy and active listening are crucial first steps when dealing with an upset individual. Question 21. What information is always required on a sterile package label in a central service department? A. The technician's name who processed the item. B. The cost of the item. C. The sterilization date, sterilizer identification, and expiration date. D. The patient's name for whom the item is intended. Answer: C. The sterilization date, sterilizer identification, and expiration date. This question relates to the critical aspect of sterile packaging and traceability. The keyword always required emphasizes the essential information for patient safety and inventory management. While a technician's name might be on internal logs, A, cost, B, is irrelevant, and patient name, D, is not typically on individual sterile packages. The sterilization date, the specific sterilizer used, and the expiration date are crucial for ensuring the item's sterility, allowing for proper rotation of stock, and facilitating recalls if necessary. For example, this information ensures that an item sterilized 6 months ago isn't used if its shelf life is only 3 months. Always remember that traceability and sterility assurance depend on these 3 pieces of information. Question 22. What is the primary role of the Food and Drug Administration, FDA, concerning central service activities? A. To ensure healthcare facilities comply with workplace safety standards. B. To regulate the manufacturing and distribution of medical devices and sterilants. C. To establish standards for infection prevention practices within hospitals. D. To certify central service technicians for professional competency. Answer: B. To regulate the manufacturing and distribution of medical devices and sterilants. This question differentiates between the roles of various regulatory bodies. The keyword primary role for the FDA points to its specific domain. While other agencies handle workplace safety, OSHA, infection prevention, CDC, or certification, IAHCSMM/CBSPD, the FDA is responsible for ensuring the safety and effectiveness of medical devices, drugs, and sterilants used in healthcare. For example, the FDA approves new sterilizers and ensures that instrument manufacturers follow quality standards. Always remember that the FDA is focused on the safety and efficacy of products themselves, from conception to market. Question 23. A central service technician is performing routine inventory tasks and discovers several sterile items that have passed their designated expiration dates. What is the appropriate action for these items? A. Re-sterilize and return them to the sterile storage area. B. Place them in a separate bin for immediate use, prioritizing them. C. Remove them from sterile stock and send them for reprocessing or disposal. D. Mark them with a new expiration date based on visual inspection. Answer: C. Remove them from sterile stock and send them for reprocessing or disposal. This question addresses the critical concept of sterility maintenance and managing expired items. The phrase "past their designated expiration dates" means these items are no longer considered sterile. Options A, B, and D are all unsafe practices because an expired item's sterility cannot be guaranteed, even if it appears intact. The correct and only safe action is to immediately remove these items from the sterile inventory and send them back to decontamination for reprocessing, or dispose of them if they are single-use disposable items. Always remember, expired sterile items are considered contaminated and must be reprocessed or discarded to protect patient safety. Question 24. What is the most crucial aspect of nonverbal communication for a central service technician when interacting with colleagues and other departments? A. Maintaining a serious facial expression at all times. B. Avoiding eye contact to show respect. C. Displaying a positive and approachable demeanor, including body language and tone of voice. D. Crossing arms to signal authority and control. Answer: C. Displaying a positive and approachable demeanor, including body language and tone of voice. This question focuses on the importance of nonverbal communication in professional interactions. The keyword "most crucial aspect" highlights the most effective way nonverbal cues contribute to positive communication. While facial expressions and eye contact are components, a serious expression, A, or avoiding eye contact, B, can be perceived negatively. Crossing arms, D, can signal defensiveness. A positive and approachable demeanor, conveyed through open body language, appropriate eye contact, and a pleasant tone of voice, fosters trust and encourages open communication with colleagues and other departments. For example, a smile and open posture make you seem more willing to help. Always remember that your body language often speaks louder than your words. Question 25. A central service department implements a new electronic tracking system for instrument sets. What is the primary benefit of this technological advancement for accountability and patient safety? A. It eliminates the need for manual cleaning of instruments. B. It reduces the required training for new technicians. C. It provides real-time data for tracking instrument location and processing history. D. It allows technicians to work fewer hours per week. Answer, C. It provides real-time data for tracking instrument location and processing history. This question examines the impact of technology in central service, specifically regarding instrument tracking systems. The keyword primary benefit emphasizes the most significant advantage. While technology might indirectly affect other areas, its main benefit for accountability and patient safety is the ability to precisely track where an instrument set is, when it was processed, in which sterilizer, and even for which patient it was used. This traceability is crucial for quality control, managing recalls, and investigating any potential issues. For example, if there's a problem with a specific sterilization load, the system can quickly identify all affected instruments and where they went. Always remember that tracking systems are vital tools for ensuring every instrument is properly processed and accounted for, directly supporting patient safety.